Schools throughout the state are on track to reopen, though at different times and in different ways. The Boston Public Schools plan to reopen with all remote learning, followed by a phase in of hybrid learning with multiple safety measures and protocols. But there's also a list of concerns put together by teachers, other staff members, parents, and advocates in the statewide Coalition to Safely Reopen Schools. To tell us about it is our guest, a coalition member and a school nurse in Boston, Jonathan Haines. Thank you very much being with
Thank
us,
you
John.
for having me.
Jonathan, I know there were many things on the coalition's list. There were many things in the plan put together by the Boston Public Schools. And I guess one of your concerns is no matter which list you go by, what about the money to pay for it?
Right, as we were talking right before this, the one big question is, in order to make the schools safe, we need money to do that. And in order to run the schools differently than we have in the past, in order to reach all the students that we need to reach, whether it's by remote learning or hybrid learning or even in person, making the schools safe, we do need more money to make these schools safe, especially in Boston and some other districts that have traditionally been underfunded through time. We haven't done the repairs to the buildings. We have old buildings that don't have adequate ventilation. They don't have running hot water in some instances. Nurses' offices. I'm getting into a lot of specifics, but I think that when you start looking at all these specifics, it all takes money. We need more custodial staff. That takes money. So I think where the money is going to come from is also because certainly the mayor's hands are tied if he doesn't have enough money to make the changes in the schools that are necessary to make it safe. And so that we're kind of against that right now with the timeline, the deadline coming ahead of, well, we're going to start having staff in schools, we're going to start having students inside the schools, but have we done enough to make them safe that we really should be bringing them back in? Because at the end of the day, if the schools aren't safe and the virus is being transmitted in the schools and brought back into communities, then the community rates will go up again, and we'll be in a worse situation than we were if we had not reopened the schools.
By the way, how realistic a fear is there? I mean, maybe the best thing we have to go on so far is what's happened in daycare centers that have been open. We're talking about very young children, and I know that's less of a problem in terms of illness and transmission, but doesn't that maybe give you some hope that maybe we can pull this off with older children as well?
Well, you have a lot more control over those young children, over the environment that those young children are in. I mean, and I think through normal development of children, we face different challenges with social distancing, using the face mask, wearing the face mask. I mean, I'm not just concerned about the students. I'm concerned about other people I work with. Are they going to keep their face masks on every day? I go walk around the city and I don't see everybody wearing face masks. And it's one thing if you're walking down the street and somebody's not wearing a face mask. That's a very low risk of transmission. If you're sitting in a room or in a building for 6 to 7 hours a day, and somebody's either not using it all the time or not following the rules, as it were, then that's a much higher risk of transmission. So school buildings are places where people are staying in the same place for long periods of time. That increases the risk of transmission, just the environment that you're in. And so the question, I understand that, and the other concern is that we now know that children, young children, not the youngest children, but school-age children, at 25% that are asymptomatic are actually carrying the disease and can spread it. And so the question of testing really does become important. And there's no plan for testing either staff or students right now in Boston. And I think that should be a precondition for reopening any building, any school building, and having people in those buildings would be available at testing and availability. This is what the elite institutions are doing. I mean, Harvard is completely remote. But other institutions like Northeastern and I believe Boston University that are reopening in Boston, they're making a requirement that anybody who comes back to school has to come in with a negative test, and there is a regular schedule of testing testing protocols that are being followed by those schools, and that's the kind of due diligence that I think that the Boston Public Schools should be following as well in terms of testing and contact tracing.
Well, in the plan put out by the Boston Public Schools, there's a reference to home health checks, which are supposed to be done by parents that could trigger a testing by the time the child gets to the school. Although to me, it looked like maybe a reference to the possibility of mobile testing, rapid mobile testing being available. So I think there's some thought going on there, but what's missing exactly?
Well, probably what we talked about at the beginning is maybe funding. Maybe you know, how would we in fact have rapid testing available so that it could be implemented easily and quickly for folks. You know, there's a contradiction in the Boston plan about parents sort of monitoring. I mean, and certainly parents should monitor that. I mean, that's definitely, that should be happening, and they should be checking for temperatures, and they should be, you know, checking, being aware of their child's if they have a little cough or something that may be developing. But on the other hand, if the school district is saying that we should be checking temperatures, the parents should be checking temperatures before kids get on the bus, and then they're saying that we don't need to check temperatures at the door. Well, if temperature checks are valid at home, they're also valid in school, and you'll get a much higher rate of actual tests going on. I know as a school nurse, many of our families just don't even have thermometers. I mean, I often get students come in and say, well, we don't have a thermometer, but I was feeling a little sick last night. Can you check my temperature? And unless the district is willing to provide thermometers to all the families, you know, in the same way that we provided Chromebooks, then I don't see a reason why we aren't checking temperatures or doing some kind of screening at the door every day. It doesn't help the bus drivers necessarily, but at least it's better than not screening. And right now, the Boston Public Schools plan, again, just says that we don't need to screen at the door every day. And that doesn't seem to be, again, it's not the due diligence that we need to keep this virus under control.
What about, you said monitoring, because, you know, there are monitors on at least some school buses. There are people in school buildings, plus you got people who have to do more cleaning now because of all the protocols. Sounds kind of labor intensive. Do you think it's going to be there when it's needed?
Well, that's also a concern, because it is everybody going to do their part? Because it's not, everybody has to do their part all the way through the day, all the way through a school child's day. So for example, the parents have to do the check at home. The buses need to be cleaned before the drivers even get on the buses. There need to be monitors. I believe there need to be monitors on all the buses, because you can't leave the driver having to look back and see, like, well, are these kids staying, are these, you know, second graders staying in their seat as they're supposed to? Are they keeping their masks on? Are they even when you look at the buses, are you going to have your first student go to the back of the bus and have to sit in the back of the bus on pickup, and then as you pick up students, they'll be sitting closer to the front of the bus? Or is that even been considered yet? I don't, again, like the level of planning and regimentation that needs to take place in order to maintain the social distancing. It's great to say, oh, we're going to keep everybody 6 feet apart, but how are you going to operationalize that? So I've only gotten to the buses, and we've seen quite a few problems and questions that haven't been answered yet, to my mind.
One of the things that the coalition refers to, at least for guidelines, is the expertise at the Harvard Chan School of Public Health. And one of the things that they say is that if you're looking at a safe range for reopening schools, if you have a district-wide figure of 3% or under for infection rates, it looks doable. In Boston, we are below that citywide figure, but if you look at the school population and the neighborhoods they come from, how does that make you feel?
Well, that's a point that nurses have been bringing up, and that has been brought up, I think, specifically by Councilor Arroyo, that if you only analyze the neighborhoods that are where most of our students come from, you'll find the rates are higher. That's East Boston is very high right now, and some of the other neighborhoods from which students come are higher rates. And so maybe in looking at that number, we need to be looking more at the neighborhoods. And I do believe that through the work of the union and some of our conversations with the mayor is considering more looking at that. He's mentioned in press conferences that we need to be looking also at the data from those particular neighborhoods, and so that's a step forward, and in sort of understanding the effect that we'll have. But that gets back to my point that there will be an increase in transmission when schools open. Although again, it's better to have schools opening in a phased in way, because it won't be all at once. If all schools were opening in September, I think that would just be a disaster, because that puts a much higher, they'll make it much more likely that opening the schools will lead to a wider community spread. Phasing it in is a good way to say, like, well, it hasn't gone up that much, it hasn't gone, and it may have an effect that we'll have, that's definitely a better effect. The question is will all these protocols be able to be done in these schools? Teachers have to teach. So far, we still have teachers that are teaching remotely and in person simultaneously in the BPS plan, and that doesn't allow them also the time to monitor the social distancing, monitor the wearing of the face mask, monitor hand washing. So there's still a lot of questions and a lot of areas of deep concern about the safety of the students and what this will mean for communities when we reopen schools. I mean, we closed the schools for a reason, which was to stop the community spread. And so when we're reopening schools, and we haven't had that study, and that's something I've been asking people for, why don't we do projections and say, like, well, if we open 50 schools, how much spread do we expect? How much do we expect those numbers to go up, and in what neighborhoods? Because those are the kind of the real questions, and those are the kind of scientific questions that can be answered. We have Massachusetts Institute of Technology, Harvard. We have lots of public health experts here, and I haven't seen the district mandate that kind of a study to say, like, really, what is going to, how is the opening of the schools going to possibly affect the spread of the disease in the community?
Well, thank you very much for taking your time to run us through that and make us think. Jonathan Haines from the Coalition to Safely Reopen Schools.
Thank you.